This is a Dubai Eye 103.8 podcast. You're listening to the UAE's #1 talk radio station.
This is Afternoons on Dubai Eye 103.8.
You're listening to Afternoons with Helen Farmer podcast. I'm Poonam Verma. On the show today, we're talking about plastic surgeries to the extreme, where some people are actually wanting to look like cartoon characters. Also, how does your personality fit your job? We get some tips and advice, especially if you're an entrepreneur, from our business coach, Phil Bedford. If you're sending or you do have kids at school in the UK, well, their prices are going up. We're going to be finding out about that later on. And also, scammers are extorting money from influencers and businesses in the Middle East. I have been one of those who has actually been scammed, so do watch out. They're on the rise. We're also talking about that subject no one wants to talk about, and that is death and grief, and how bereavement actually affects our health. And finally, women's body image. Does your culture affect how you view and how confident you feel about your body? Make sure you tune in every weekday to Afternoons with Helen Farmer from 2 p.m. Now, me and Milani came across a story which was about how doctors are alarmed by influencers who are having extreme procedures that make them look like cartoon characters. It's quite scary. I've seen them. A lot of them have been popping up on TikTok with exaggerated features such as extra pointed chins, enlarged cheekbones, you name it. And although the eye-catching looks help influencers gain thousands of followers, surgeons warn that these extreme and disturbing procedures can have severe mental and physical health consequences, including tissue death. Now, in the UK, it's a crime under the Offences Against the Persons Act from the 1850s to perform extreme procedures. But what about this region, and how is it affecting young people? So with me, I have two experts joining me. Dr. Miriam Byrne, she's a plastic surgeon from Reem Hospital in Abu Dhabi. Her expertise is plastic, reconstructive and aesthetic surgery. And Dr. Charlotte Cousins is back, clinical psychologist from Maudsley Health. Welcome, ladies. Thank you for joining me today.
Thank you.
Hi.
Nice to be here.
So let's talk about this. Now, plastic surgery isn't anything new. We've seen it throughout Hollywood and the music industry for decades. And now, thanks to no thanks, I should say, to the Kardashians, they've kind of made it very normal, because we've actually seen it in their reality show. The mom's gone in for it and she's come out like she's just gone to the dentist. So in many ways, young people now think it's very normal to do something to your face, and there's actually nothing wrong with it. Now, I'm not sure about you, but I grew up where we didn't do plastic surgery. We still don't when I go home. We don't have hair extensions or fake eyelashes. It's all very, very natural. But I know social media and the culture you grow up in, the regions we grow up, there's a massive influence. So let me start with you, Dr. Miriam. Have you seen the demand for looks and the procedure types change over the, past 10 years?
Absolutely. And I think as well that it correlates to where you are in the world. And it's interesting that we're here in Dubai, which has the highest number of plastic surgeons per capita in the world. And this is, if you look at New York, Los Angeles, Brazil, here in Dubai, we have the highest proportion of plastic surgeons. So we say that the average standard is to have one plastic surgeon per 100,000. And with the population here in Dubai of 3 million, we'd say that's 30 plastic surgeons. But there are actually 300 plastic surgeons here. And that's an incredible statistic. And I suppose we've seen a remarkable growth in medical tourism as well in Dubai. For example, in 2022, there were 670,000 medical tourists, and they were spending 990 million dirham, which is the equivalent of about 250 million euro on plastic surgery. And that was a substantial increase on the previous year. So the demand is there, people are traveling, but exposure to social media has really, really kind of changed people's perception of what the norm is. And I guess it's going further and further away from what was characteristically seen as beauty.
I just feel like people are becoming clones and being natural is becoming a rarity. And I just feel like telling young people that is going to stand out in time. You don't need the duck lips and all these very bizarre things.
Absolutely. And I think it's interesting that you say young people because, prior to coming on, I was looking at a very interesting article that was published 2006 and another in 2018. And it was looking at messages about physical attractiveness in animated cartoons. And we see that the article that we're kind of referring to from the Daily Mail, some of the characters there were, kind of emulating to be cartoon-like figures. But there's a lot of research into this, and it shows that children's videos often overemphasize the importance of physical appearance, unlike children's books. And I guess people are now looking at videos, social media more than actually reading. And, characters like Cinderella and Snow White, they focus heavily on female beauty, while like kind of the less beauty-centric tales, the fairy tales, they're forgotten about. And this study kind of, looked at attractiveness and what it correlated with. And characters are more likely to be portrayed as happy, intelligent, employed, attractive characters. They're, more pro-social, they have better recreational activities, they're more liked. And typically that's the female that is thin with the right curves, younger, and the men then that have the big biceps and the ripped abdomens. But now it's even becoming more pronounced, and some of the facial features, people are wanting to look more cat-like, more feline. And we have patients coming in, asking for kind of trend labels that they're looking for that aren't essentially plastic surgery procedures that would be recommended or have guidelines to practice them. And I suppose very integral to all of this is providing plastic surgery in a safe environment where there are guidelines and standards, and we're not veering off to just kind of gratify trends that are being performed in plastic surgery around the world.
What has been the most extreme request that you've had when it comes to plastic surgery or face transformation, Dr. Miriam?
Well, I have had essentially patients that may have visited many countries around the world. And one such patient had transformation to look like a tiger. And essentially a surgeon had transformed the jawline, the bones, the malar area, the orbital area, and the patient was extremely cat-like and feline. And essentially, the patient wanted me to go a step further and even be more extreme. So, a situation like this, clearly I'm not going to engage in any type of surgery, but it's very important for the patient that they are tied in to somebody that can help them, discuss what they are experiencing, why they feel they need, this kind of extra additions to their face, and what they're internalizing. And I suppose that's really where body dysmorphia comes in. And we do see patients regularly with body dysmorphia. And we know this is where, patients have a real preoccupation with something that they perceive as completely abnormal. And we see it increasingly so in teenagers and young adults. And it's not about being vain or self-obsessed, but they might have a specific area of the body that they are, preoccupied with, absolutely procrastinating. What can they do? And it has, detrimental effects on their daily life. And I suppose that's where the psychology really, really comes into, having a solid base to perform a plastic surgery on a patient. But, these extremes of surgery, having gone through a very rigorous training, guidelines, adhering to the most evidence-based guidelines and surgical options, I think that keeps us very centered on what we should be operating on and what to, try and counsel a patient to get them into the psychology, into the system, to discuss what's actually going on.
Okay, now, I don't know if either of you ladies have seen this film with Nicole Kidman and Zac Efron called The Family Affair. It's recently come out. And
Yes.
yeah, I don't know if it's me, but I was really disturbed. I was just felt like there was more plastic on their faces than in the ocean. It was horrendous watching it. And then I went onto the social media pages. Everyone made a comment about their faces. So I want to ask you, obviously they're celebrities, they have the limelight, they need to look as young and as perfect as possible. But are there specific personality traits, Dr. Charlotte, or psychological conditions that make the everyday person or influencer more likely to seek plastic surgery?
Absolutely. So I guess we know some of the psychological reasons why people might be seeking out the plastic surgery are sort of low confidence, dissatisfaction with their appearance, and also dissatisfaction with previous, maybe more traditional and less extreme attempts to improve their appearance. So we often see them then kind of going for these more extreme attempts and sort of procedures in the hope that will be the one thing to kind of really change how they feel.
But have you actually seen it improve people's self-esteem and body confidence? And when it does, is it just a temporary fix?
I think it's a really complex issue, and it would be really interesting to hear kind of what Miriam thinks. I guess we know that it really varies. So for some people, they will see an improvement in self-esteem or anxiety and depression, and in others they won't. They'll see a real worsening, either kind of shortly afterwards or in the long term after the procedure. And that, I suppose, really highlights and emphasises the importance of proper screening and really thorough assessment to really understand kind of the motivations behind the surgery, kind of their feelings, their expectations, their kind of general readiness, and really making sure that someone, if they are going to go ahead with the surgery, has access to the right support, maybe including kind of mental health support and therapy, sort of in the lead up to and after having surgery.
Dr. Miriam, do you have to work with mental health experts before doing any kind of surgery on someone?
Yeah, absolutely. And I think you've really hit the nail on the head there. The process of selection towards any of these procedures is very rigorous. So typically when a patient comes to the practice, I would see them for the first consultation, which takes about 50 minutes, 40 to 50 minutes. And not only are we looking at their medical background history, but we try to ascertain what the expectations of the patient are, how realistic are their expectations of the outcome of the surgery. Sometimes we have patients, they want a specific part of their body addressed. Maybe a lady comes to have a breast lift, a breast reduction, or a breast augmentation. They might want a mummy makeover, a tummy tuck. And we spend time discussing not only the surgery, but the complications, the aftermath, the support system, the follow-up. But we have to make sure that they're in a very stable place to have this procedure, because surgeries, when they're carried out safely, they can still have complications. And if a patient has an unrealistic expectation or is expecting, like a lot of patients say, oh, but there is no complications or there is no risk. And that is something that we as surgeons have to take, kind of a lot of time to, explain, understand the patient and make sure they have a very, very realistic outcome for what they're having. And yes, we do, if there are any patients that we feel that require a psychological assessment, they are referred to the professionals, because I think they need this in the aftermath of the surgery, because the surgery is only one element, but coping with the aftermath, sometimes if patients have body dysmorphia or mental health issues, they can deal with it, with quite a, reactionary, and we definitely need the support of our psychologists and psychiatrists.
Let's talk about addiction, because I've heard stories, real life stories, where someone's probably had a nose job and it's gone really well and they like it. Now they think, oh, that went well, maybe I'll get my breasts done. And then it keeps going on and on and on. Is there an addiction? Because I have heard of these stories before where they just don't know where to stop and it's a constant improvement.
Absolutely. And I think, and that's very often just how it starts, with one or two surgeries, and then we see in the media, famous actors and people wanting to emulate them. There are certain individuals that might have 3, 4, 5 breast augmentations, going larger. They have, fat injections that are extreme. They're overfilled. They have, they're trying to achieve, characteristics that just are not suited to them. But even more than that, we talk about the golden ratio in plastic surgery, and this is what the ideal norm and the ideal beauty is. So this is a ratio, and it can be calculated looking at different parameters. But patients, when they want to emulate their fantasy characters or actors and actresses, they feel that having extreme surgeries are the only thing that can actually help them. And we've seen people that want to look like Kim Kardashian, and they've had multiple procedures. And we have men that also want to look like Kim Kardashian. So that's a very, very, radical, surgery. But we have to ask, who are performing these?
Yeah.
These are not, necessarily board certified surgeons. So the credentials of a surgeon are of paramount importance. Yeah. So I would say to anybody that is looking to have any type of plastic surgery, knowing your plastic surgeon, knowing their training, their experience, what their specialty area is, knowing that they have a correct license for where they're practicing. All of these things are extremely essential, and you should look at the outcomes of what a surgeon is performing. Nowadays, we see a lot of images that are airbrushed, that aren't true, surgery, and patients are coming with pictures going, I want to look like that.
And years and years ago when Instagram first started, my friend was posting a picture of herself, and then she started squeezing the screen, and I said, what are you doing? She went, I'm using the Skinny app to make my waist look thin. And at that point, I was like, I don't believe anything I see anymore. I really, really don't. So I think we're running out of time now, but Dr. Charlotte, I think it's really just building confidence and self-love as young as you can in those children and teens as you grow up, right?
Absolutely. And really shifting that emphasis away from kind of appearance, just as kind of Dr. Miriam was mentioning earlier. Sadly, for generations, there's been such an emphasis, particularly kind of for small girls and women, on appearance, and that being kind of how we're judged and a sign of success. So we absolutely need to kind of broaden that out and really focus on self-love, really focus on confidence, really developing a sense of value and importance that goes far beyond and is not associated kind of with appearance. Yeah. And another part of it is, I guess, helping people learn from a really young age to kind of critically assess and critically evaluate the information that they're seeing. So not just taking these kind of snapshots and these images that we see on TikTok and Instagram and taking them at face value and knowing that, just as you were describing, these images are often so heavily distorted and aren't a true reflection of how that person looks. And also, they're not a true reflection of how that person feels about the way that they look.
Oh, yeah.
So they might be, we know that people are often, even though they're doing all of these selfies and kind of saying, look at me and this wonderful surgery that I've had, they still feel awful about themselves on the inside. Yeah. And we don't get to always see that because people don't talk about that so much online.
Yeah, no, I mean, this topic can go on for ages, so we'll have to close it up for now, but we'll get you guys back on again. Thank you so much for joining us, both of you.